Hello, my name is Robert Zeiser. I'm the director of the Division of Tumor Immunology at Freiburg University Medical Center. Today I will present you the ASH abstract entitled Itacitinib and Corticosteroids as initial treatment for chronic graft-versus-host disease, phase 1/2 results from GRAVITAS-309. The abstract will be presented at ASH by Dr. Annie In from the University of Pittsburgh Cancer Institute. The rationale for the study is that itacitinib is a JAK1 inhibitor with anti-inflammatory activity that could be beneficial for patients with chronic GvHD. The study GRAVITAS-309 was designed as a two-part multicenter randomized trial to assess efficacy and safety of itacitinib in patients with severe or moderate chronic graft-versus-host disease in the first-line treatment. The study initially investigated itacitinib at doses of 200 mg once daily and 300 mg once daily in combination with corticosteroids. Both doses were well tolerated, and this trial then expanded to test itacitinib 400 mg QD and 300 mg twice daily, and included a corticosteroid monotherapy cohort. The expected corticosteroid starting dose was 0.5 to 1 mg per day, and the primary objective was to identify the appropriate dose and schedule of itacitinib for further development. In this trial, 103 patients were enrolled and received at least one dose of itacitinib. The itacitinib 300 mg BID dose cohort was discontinued early due to malignancy relapse occurring in 4 of 29 patients, which equals 14%, and more patients requiring dose reduction compared with the 400 mg QD and 300 mg QD cohorts, mostly due to cytopenia in the patients. The incidence of grade 3 or higher treatment emergent adverse events was higher in the itacitinib cohorts compared to the corticosteroids cohort, and were reported most commonly in the system organ classes of infections and blood and lymphatic system disorders. The overall response rate at 6 months was 46% with 300 mg QD and 53% with 400 mg QD versus 36% with corticosteroids. A preliminary exposure response analysis showed a bell-shaped curve with maximum efficacy decreasing at higher exposures, which is consistent with increasing incidence of adverse events. The conclusion from this study is that for first-line treatment of moderate or severe chronic GvHD, an increased overall response and CR rate was observed in combining corticosteroids with itacitinib versus corticosteroids alone, both in the 300 mg QD and 400 mg QD cohorts, however, at the expense of increased rates of cytopenias and infections. Thank you for your attention.